Correct. Hello all. Good afternoon. This is Dr. Shilpi Reddy, Head of the Department, Kim's Cuddles Mother and Child Center, Kondaour, Hyderabad. Today we're going to discuss about a very important topic called urinary incontinence. Urinary incontinence is an involuntary leak of urine or overflow of urine unknowingly or knowingly when there is a lot of stress. So it doesn't seem to be as simple as it is told, because urinary incontinence, it is a more so likely a social problem. It debilitates you and your confidence internally, because socially it is not very well acceptable, and because of its highly unpredictable nature, people do suffer both physically, mentally, and psychologically also. So, urinary incontinence is a problem that has to be dealt in many more ways other than just medications. If we have to talk about urinary incontinence, there are different types of urinary incontinence. The most common though is stress urinary incontinence, wherein increase of abdominal pressure. It can be because of cough or sneeze or some exercise or any other lesion, any other pressure, like sometimes bending or sometimes getting up or sometimes lifting heavy objects, can cause urine leak. So this is basically any stress that causes raised intra-abdominal pressure. There is a leak of urine. Similarly, like stress urinary incontinence, there is urge urinary incontinence, wherein you get an urge of passing urine, but by the time you reach the washroom, you pass urine. So this can also be because of any other problems related to mobility, like arthritis, or before you can open up to pass urine, you usually pass urine. So other than the stress and urge urinary incontinence, we have overflow incontinence, wherein you have frequent constant dribbling of urine because of overflow. So major forms are usually stress and urge. Other forms are like overflow, and there are some cases of functional urinary incontinence also, based upon the local problems that they have. Not only this, there are other scenarios where we have mixed scenarios, like urge along with stress and functional component, increased functional component giving rise to urge incontinence and all that. So there are specific bladder-related problems, bowel-related problems, and all that, and also other systemic problems that can cause these things, like paralysis or bladder neuropathy or any arthritis or any debilitating condition that can restrict your movements and all that. And when it comes to when to see a doctor, most of the time people, sometimes they take their own time and they don't report to the doctor as soon as they see the complaints. They try to rectify themselves, they try to bear, they try to use some methods like a napkin or a panty or something like that to stop or control that, and do come present to the OPDs or to the doctor a little late. Some kinds of urge urinary incontinence are usually detected early, because they can be because of urine infection. So if they have fever or urinary tract infection, they usually come to the doctor. And together, when they have urge urinary incontinence, they clear off the symptoms. Similarly, neurological problems, chronic diabetes, that can also cause urge urinary incontinence and concomitant infections also. And some people with spinal cord injury or somebody who's paralyzed, all these things, their kind of incontinence is accessible and managed by the doctors with concomitant problems. But usually people present little late owing to social stigma, and they have lesser access to healthcare and all that. So incontinence issues, uh, usually people come to the doctor when they have some limitations due to this problem in social interactions, or when the quality of life is disturbed because of this. And if there is urge incontinence and they go fast to void urine, and there comes a history of fall or trauma, that is when they usually report to the doctor, and then they complain about these problems. So associated problems, associated lifestyle disorders, or social problems that they're facing is what brings them to the doctor. And reporting to the doctor is really, really important, because not only there is a problem that has to be identified, it has also to be rectified. That is really, really important. To discuss about the coming up causes for these kind of incontinence issues. You have so many things in your lifestyle that you don't feel that these can contribute to incontinence also. But yes, there are certain, regular habits that that can be temporary causes of incontinence. Occasionally, we see these kind of temporary causes causing incontinence, like alcohol intake, binging of alcohol, or it can be a lot of caffeine intake, a lot of intake of carbonated waters, artificial sweeteners that can cause these problems. Uh, and if you have to talk about other things like substance abuse, can also cause uh, incontinence issues. Even smoking can cause incontinence issues. Chili peppers intake can cause incontinence issues. Lots and lots of citric fruit or citric materials can also cause incontinence issues. But these are all very temporary. And sometimes antihypertensive medications can cause incontinence issues. Sedatives, muscle relaxants can cause incontinence issues. Very common. Urinary tract infections can cause incontinence issues. Severe constipation with increased abdominal pressure, almost around the same area, the rectum and the bladder compression. So that can cause incontinence issues. Though these are very temporary, you can definitely rectify these kind of issues on changing your lifestyle, and it can be better habits, and regular avoiding of bowel habits, and prevention of constipation, treatment of constipation, identification and specific treatment of urinary tract infections, stopping alcohol, stopping smoking, and shifting over to another antihypertensive medication that does not have the same side effect. So these small changes in your etiological causing factors can definitely go in a long run. There are certain persisting factors that can cause urinary incontinence, and long-term factors that can cause incontinence, like pregnancy. Sometimes people from early pregnancy itself, because of raised intra-abdominal pressure and pressure from the bladder by the growing uterus, and especially in the third trimesters, they have these incontinence issues, and it persists for some time till you deliver, and even post delivery also couple of weeks it remains. So these are some kind of persistent factors, like pregnancy, childbirth, that can loosen out the pelvic floor, and there is drooping and little relaxed pelvic anatomy that can come down into the lower into the pelvic floor area. So all these things can cause anatomical distortion, and there are certain age changes, especially in women when the age-related estrogen comes down, menopause comes in, and estrogen levels are down. The support system, especially post-normal vaginal delivery, the support system, the vaginal muscles and the ureter muscles and all, they go loose, and then there is some collagen problems. All these things add on to loosening of the pelvic floor muscles. That causes a little bit of prolapse, and according to the degree of prolapse also, there is a certain amount of urinary incontinence that we see. So pregnancy, childbirth, age-related changes, menopause, all these things add on to the factors in the woman's side. And if you talk about factors in the men's side, it can be prostate abnormalities, prostatic hyperplasia, and prostatic cancers that can definitely cause the urinary incontinence. So these two reasons are very, very common, and any obstruction to the flow of urine somewhere, some growth can definitely cause these kind of incontinence issues. And there are a set of neurological abnormalities, like neurological disorders like multiple sclerosis, Parkinson's disease, disorders like spinal injury, stroke, brain injury, or brain tumors at the space occupying lesions that can put pressures of the nerves that supply into the bladder. All these things and neurological issues, they have little more persistent, conditions for stress, or persistent conditions for urinary incontinence. When you see so many reasons, definitely you feel that what is the specific reason that is causing this problem? Where from these, where is the grassroots level of problem that has caused this kind of an incontinence is what you have to discover. So when you have to talk about, complications of stress urinary incontinence, what is the ultimate effect of this urinary incontinence? Because urine is dribbling and leaking. Other than the physical discomfort, there is a lot of exfoliation of the skin in that area. There are chances of recurrent urinary tract infections that can happen, and there is a vast impact on their personal life, their social life. It disturbs them in many ways in terms of planning their daily activities, or going out somewhere that they have to tackle this issue. All these interpersonal relationships also get disturbed, especially with prolapse and other issues. There are even events where their sexual life is also disturbed. So urinary incontinence per se is not a simple problem that is with an organ and that is reflecting over things. It has an impact on overall social life of the person. So it's really, really important that we have to know what is the cause of the urinary tract infection, the cause of the urinary incontinence, whether it is temporary cause, whether it is a persistent cause, whether it is causing a lot of social issues or any other problems in the person's life. So all these things matter a lot. And when we have to talk about how to solve these things, prevention comes in at the topmost aspect. How to prevent the urinary incontinence is one's major role that has to be fulfilled on a regular basis. Because what, in terms of lifestyle factors that take care in your life, definitely that impacts as and when the prevention has to come into place. So when we have to talk about preventive aspects, obesity is one of the major causes of increased abdominal pressure, weakening of the muscles, and all that. So weight management is very, very important. You should prevent anything that causes obesity. So obesity has to be definitely under control. Your pelvic floor has to be in a good form and support. So pelvic floor muscles, any insult to pelvic floor muscles has to be managed and taken care of. You cannot postpone things. Today you had a vaginal pelvic. You think that probably after 6-7 months I start my Kegels exercises or something like that. No, just not that. So pelvic floor muscles strength and texture and anatomy has to be maintained well, especially when it is pregnancy and post majorly you have to follow the Kegels exercise regimes, and definitely avoid the bladder irritants like smoking, like alcohol, like drug abuse, like any other drugs, antihypertensive medications. So all these things are bladder irritants, especially the carbonated beverages and citric, high doses of citric intake. So all these things have to be a little bit rectified. And if it is about constipation, yes, increased fiber food, that is important in easy evacuation of the bowel, and the constipation has to be rectified in order to prevent the cross problem with the incontinence issue. So these are some highly preventable factors where you have to look into the aspects of lifestyle, as I have told you, obesity, substance abuse, avoid bladder irritants, increase fiber intake, uh, not smoking, and good pelvic floor exercise regime. These are very, very important for anything that has to be as a preventive mechanism. When you have to talk about who needs prevention, who needs extra care, like when we have to talk about so many other things, we have to talk about the risk factors. Risk factors for urinary incontinence are pretty much defined as they come with the gender. Yes, the risk factors are more in women, and in men with prostatic problems. When it comes to age, yes, the urinary incontinence is much more related to age group, perimenopause and postmenopausal age group, where the estrogen levels are down and you have more chances of development of genital prolapse and the specific and the urinary incontinence together. And if you're overweight, yes, that is another independent stress factor, the risk factor for the urinary incontinence. Overweight, being overweight definitely is one of the major risk factors. Then anything that irritates, like smoking, family history, that is also a risk factor for urinary incontinence. And diseases like neurological problems, all these things again are risk factors for urinary incontinence. Recurrent urinary tract infections are also one of the risk factors. So it is very, very important that both are taken care, incontinence and infections, both together are taken care in preventing these problems in the long run. And whenever we have to discuss about anything, it is about prevention is very important, and to identify the risk factor is definitely important. The next level of talk can be about the diagnosis. How do we even diagnose urinary incontinence? Yes, definitely the history itself is very revealing with what kind of an incontinence the person is having, whether it is stress or whether it is urge, whether it is overflow, or whether it is functional, or whether it has mixed component. History gives it a very good insight into it. So what we have to do is, the minimum investigations we can do is urine examination, look at any infections, urine culture, specific antibiotics that we can give. Only then the urine infection is going to clear. Just community-based, just over-the-counter medications do not usually work. Nowadays, urine infections are quite specific, and identification of the organism and treatment as per the antibiotic sensitive profile is really, really important. And when we have to talk about the history, we definitely have to ask them to maintain a bladder diary, and then write down what is the intake of fluid, when did they pass through, what was the issue, and that, so that we will have an idea into what is going on in on their side. So that definitely has to be elicited, because if you don't take proper history and proper problem analysis, you will not reach into apt diagnosis. And solution giving is again a problem to them. So definitely urine examination, maintenance of bladder diary, and reading out the diary properly, and to check the post-void residue. An ultrasound examination is definitely warranted to check the post-void residue. If there is any post-void residue, then you have to note down that what kind of an incontinence can cause these problems and all that. Along with these, there are simple urodynamic studies which show us the flow pattern and how is the flow happening, and what can you do to diagnose this flow pattern abnormalities. So urodynamic studies do help us in checking all these things. But when you have to come into the diagnosis, you have to look into the clinical aspect of complaints, the examination findings, is it prolapse, is it lax perineum, or is it the descent that has caused these problems. So a thorough examination is also very, very important in terms of women. And in terms of men, definitely ultrasound examination can detect benign prostatic abnormalities, hyperplasias. All these things can be identified. And many prostatic cancer, there are specific markers of prostatic cancer that you can do and figure out. So, what is the next is the treatment aspect. When we have to talk about treatment aspect, definitely the diagnosis has to be in your hand with the help of the investigations, the clinical examination, the history, the routine. So, what is needed for the treatment and therapies is not only about medications. Medications do come in at a later date, but behavioral therapy is really, really important and it helps a lot, especially where for urinary incontinence, the major focus is on behavioral therapy. What do you mean about behavioral therapy? There are techniques that you can train your bladder. So, voiding at regular intervals and voiding after taking liquids, or every 2 to 3 hours you go void your urine. If there is incomplete voiding, wait for some time and again pass urine. So, these are certain bladder training techniques that you can do. And you can maintain a diary of intake and output. That if you're taking a lot of liquids, then yes, you need to pass more frequently. And bladder training in terms, as I explained about double voiding, can also, clear off the urine the second time you void. Because first time it is incomplete voiding that is happening. That you can easily figure out in the ultrasound where if your incomplete voiding is there and still residue urine is there, you pass the second time, it passes off. And you can have scheduled toilet training sessions, and then fluid and diet management can be done on a regular basis. Your pelvic floor exercises. So it is very, very important to train your pelvic floor to strengthen the pelvic floor muscles. The most important the pelvic floor exercise to strengthen the muscles is the Kegels exercise. When you have to talk about Kegels exercise, Kegels exercises are to be done especially when you're pregnant and after your delivery, irrespective of what is the mode of delivery, because there is some kind of an insult that definitely happens because of the weight that the pregnant woman carries. So Kegels has to be practiced by all pregnant women and post-delivery for a couple of months. And make it important when you're practicing the holding of urine and the relaxation of the sphincter, the practicing mechanism. You start with 2 to 5 seconds of holding the urine and then relaxing 5 seconds, holding and relaxing 5 seconds each. And then you increase in such a way that tightening and holding is for about 10 seconds. So you can do any number of times. You can do Kegels exercises while sitting, while watching television, while cooking, while doing any other activity. Kegels does not divert much of attention, so you definitely can do it on a regular basis as and when possible. So Kegels exercise definitely it is one of the best exercises to prevent all these problems and also as a first line of treatment for any mild and moderate symptoms of incontinence. So most of the time with bladder training and with Kegels exercises, most of the time the problems do rectify unless until they are associated with major degrees of descent and anatomical insight. So usually Kegels does rectify mild moderate problems. So when it comes to medications, there are so many medications, bladder dysfunctions and urinary incontinence and all that. So there is a range of medications that we give specifically for associated with women, associated with men and all that. On top of this, there is estrogen supplementation creams that we usually give for women, especially to strengthen the texture of the vagina and the perineum. Because sometimes lack of estrogen and postmenopausal age, there is a lot of dryness and there is a lot of problem that comes with the vaginal area. So sometimes estrogen replacement is also done in the form of creams in the local area. And there are so many other mechanisms like electrical stimulation, the nerve stimulation, where the sacral nerves are stimulated by a small piece of sacral nerve stimulating devices. There are n number of practical things that usually come for the management of incontinence. But time-tested methods as physical methods are moving for the and the Kegels exercises. And as good surgical procedures are also there, like slings, the electrical supports, like the diaphragms, the vaginal pessaries. All these things give support to the uterus and the perineal muscles, and in turn give support to the periurethral area. There are treatments, you won't believe, Botox and fillers and all these things that enhance the sphincteric action and as mechanical, devices, they work for stopping the urine leakage and everything. So there are even devices that even if you are planning for a sport or some kind of a game and you feel that you might have incontinence, there are even sphincter blockers, the urethral blockers, where you can block the urine flow by blocking the urethra, the outlet of the urethra. So that is also available. And sometimes the doctors even advise where there is obstruction, you can regularly use urethral tubes so that the urine is the urine is cleared after some periodic time on a regular basis. So these are definitely there. And when it comes to problems that need surgery, surgical involvement usually is when the medical needs fail, the lifestyle needs fail, and the physical exercise and all that you're doing and Kegels and all these things are not giving you any results. And there are local methods like Botox and fillers and the physical methods like diaphragms and the pessaries, all these things, ring pessaries, all these things are not working, then definitely you can move forward for the surgical methods. There are lots of surgical methods wherein you have slings, you have operative procedures of fixing the design and all these things. So there are sling procedures, there are bladder neck fixation procedures, there are surgeries for prolapse, genital prolapse, depending on the grade of prolapse. There are anterior to urinary sphincter fixation techniques. So there are so many techniques technically to deal with failed medical management and physical exercise. So definitely, categorically, when you check on things and when you look into the aspect, what is that that is required for complete management of the urinary incontinence? Definitely, what is required by the patient is what is important. So we look into many therapies that are available. But one thing I always say is early reporting. You should always, given a chance, try and concentrate on prevention and early reporting. Prevention, yes, prevention mechanism is definitely possible. And when factors like obesity, smoking, alcohol, Kegels exercises during pregnancy, early detection of prostatic hyperplasia, all these things are in place. Definitely, prevention aspect is much more stronger. And even if you find small symptoms, if you rule out urinary tract infections, you do Kegels at the early stage, definitely urinary incontinence rectifies to the maximum amount. But when you neglect over a period of time, then definitely it reaches out to a position where only surgical intervention can give you solutions. And depending on any neurological problems, like people who have spinal cord injuries or brain tumors or bedridden or anything like that, they have different kind of solutions, like maybe wearing some padded costume so that it gives comfort, and barriers or sponges or something like that. So if they all these things, and there are people who go on long-term catheterization for the complaints that they have. If they have paraplegia or hemiplegia, definitely they usually go for long-term catheterization or suprapubic exit for the urine. So all these things are technically rarer form, but yes, depending on what the problem is, you have solutions for the problem. So when you have to talk about um, uh, problems of bladder, that you know bladder obstruction, bladder neck problems, or incontinence issues, they are slow in appearing, because if you have a urinary infection, then probably any amount of recurrent urinary infection, you can have that sudden development of urge or all these things. Otherwise, long-term problems associated with incontinence slowly develop with age, slowly increase in intensity, and they are slow developing, usually over a period of years. So when you early identify such problems, definitely you have a lot of options that in preventing the problem, lot of options in terms of exercises and small changes in daily diaries that you can do and rectify the problem. And once, if you have identified that problem has increased and it is causing a lot of problem, then they don't stop for slow recovery. They want recovery immediately. So when recovery is wanted immediately and the results are wanted immediately, then exercise and slow relieving problems, they don't come into place. Usually surgeries or any other physical forms of intervention come into force. That is how expectations of patients and delivery of services come in. So whenever there is a small degree of problem, there is smaller solutions. When there is a large degree of problem, the solution usually point out to surgical intervention and rectification. So all these things come in, and really talking urinary incontinence is not a simple subject, and definitely it's something to deal with the super specialty for urogynecology, especially in women. There are specialists who deal with urogynec, and we have special situations where we have solutions for urogynecological issues, and the treatment is, though very, the problem is very cumbersome. The treatments are there, and very good specific intervening treatments are available currently. Definitely, we can rectify any problem that is given to as a challenge. And urinary incontinence nowadays has very good treatment options in terms of even surgical correction treatments are very wide and easy. Easy on the patients because they are usually laparoscopic. They are usually daycare procedures that are also available. So it is about the social taboo that people don't reach out to doctors. But yes, definitely when you reach out to doctors, the solutions are easier and it doesn't take much of a time. It is only about what kind of an incontinence that needs to be diagnosed and therapy advised accordingly. Medical medicines are there, lifestyle modifications are there, treatment aspects do cover about surgeries also. It depends on what kind of a problem is there, diagnose and treat in a very specific manner. So I will check for any questions as of now. There are any questions? We take questions. Somebody has asked about what is double voiding. Yes. So, when we have to discuss about double voiding is usually advised for people with incomplete voiding of urine. How do we find about incomplete voiding of urine is whenever there is a patient who comes in for examination of urinary incontinence, we advise an ultrasound wherein pre-voiding and post-voiding, we check the urine that is there in the bladder. Pre-voiding is bladder full. So whenever they get a sensation of bladder fullness, then we ask for an ultrasound. We ask them to void the urine and come back, and then we check how much urine is left over or is it completely empty. The bladder is completely empty. So when we find out that, say for example, full bladder is 500 ml and after passing the urine it is 300 ml, then definitely we ask them to void twice. That means when they go to the washroom, they pass urine and wait for a couple of minutes and again try to pass urine. That is when the complete voiding happens. So it usually is a condition of partial voiding that we diagnose and then we ask double voiding. So when they pass urine twice, if they are emptying it completely, we ask them to follow this on a regular basis. So this is called double voiding. And some question says that how does constipation impact on incontinence? Especially, I see this problem in the first trimester pregnancy. Yeah, it can impact anybody who's having chronic constipation also. What happens is the rectum is completely loaded with the fecal matter, which becomes very hard, and there is a lot of space occupying that happens. And the pressure is directly put on the uterus and onto the bladder. So that causes abdominal pain, abdominal discomfort, and urinary incontinence. So in such people, if we do not elicit the symptom or signs of constipation, again we will not be able to rectify the incontinence issue. So definitely anybody who comes with incontinence issue, you have to ask them about the constipation that they are having. If they have constipation, a small ultrasound examination to check whether it is loaded rectum, or even sometimes when you examine, transvaginal examination also, you can feel the loaded rectum that is there. So you can feel the loaded rectum also. So that can put pressure on the bladder itself because it is almost in the same area that they have stayed together. So once the constipation is relieved and they don't have complaints of urinary incontinence, then definitely it is because of the constipation that the urinary incontinence starts. So that is why constipation is linked to urinary incontinence sometimes. And some question says, when do you ask for Kegels exercises in pregnancy? So, pregnancy is a condition where definitely there is increased intra-abdominal pressure, and there is increased intra-abdominal pressures, and the uterus is growing on a daily basis. From the second, if you have complaints of any, incontinence or any other issues in the first trimester, then your Kegels has to be started in the first trimester itself. And definitely you have to look into aspects of any urinary tract infections or any subclinical urinary tract infections that are causing these problems. So urine culture also has to be done. So when urine culture is normal and there is no infection and still the urinary incontinence is there, you have to ask them for Kegels exercises wherein there is strengthening of the muscles around the sphincter, and then once the muscles strengthen, the urinary incontinence issue settles. So if that is settling, they have to continue the Kegels exercises all throughout pregnancy, even after childbirth for a couple of months, so that the tone of the muscles and strength of the muscles is maintained. That's really, really important. They just can't leave it over things, and they cannot leave it and say that after delivery I'll take it. No. The incontinence issue might increase and might go way more harder than what it was before. So definitely have to do Kegels on a regular basis. Those who do not have an issue with any incontinence during pregnancy, Kegels exercises have to be done from the second trimester onwards, even postnatally for about 3 or 4 months on a regular basis to maintain the strength and tone of the muscles. So that is really, really important. Some question, other questions. So that's all. No more questions as such. So this is all about urinary incontinence in detail and in depth. And early presentation is really, really important. Lifestyle modifications are really exercise plays a very good role. And early recognition and treatment definitely helps incontinence. And it is the type of incontinence that has to be diagnosed. There are specialty clinics for incontinence, and we have a very good uh, team for treatment of any urogynecological problems. And once reported early, we will have definitely non-surgical interventions that take in a very major role. Usually, people who report late or with not advanced genital prolapse, then surgical interventions are needed. Definitely, it's preventable, and treatment can be taken as early as possible. Thank you. What about? Yeah, you can end this.